Okay, let's talk a little bit about the concept of perfusion and anti-anginal drugs. Well, what is angina? Some people call it angina, and angina depends on what part of the country you're from or the world. Angina pectoris means chest. It's the pectoris. Pain is angina. And that happens when the supply of oxygen and nutrients in the blood isn't sufficient to meet the demands of the heart. And that pain that the heart feels is an ache, it's an actual real pain. Um, and so it's real. The heart requires a large supply of oxygen in order to meet the demands that are placed on it. And it's a really fine balance between the oxygen supply coming in and the demand. And so that is why there is pain when the heart is starved for oxygen. It's a sign that something needs to happen or change. We call the lack of blood flow ischemia. So any organ that has a lack of blood flow, like maybe the kidneys, we'll call it renal ischemia, or the brain, cerebral ischemia. That means there's poor blood supply. And ischemic heart disease means that there's poor blood supply to the heart muscle. This can come as a result of atherosclerosis clogging the arteries or actual coronary artery disease. A myocardial infarction can also cause ischemia, and it can lead to things like necrosis of the heart tissue, death, or death of cardiac tissue. It can be disabling or fatal. So there's different types of angina. I shouldn't go too much into this. This is more into your level 3 med surg. But for the sake of understanding pharmacologic management, you need to understand a little bit about why we treat them differently. So chronic stable angina, it's classic, or effort angina. Think going out to mow the lawn. So you have a 67, 68-year-old person that has chronic stable angina. They get through their day until they need to exert themselves. When you exert yourself, your heart has to keep up with the demand. And that means the heart itself is going to demand more oxygen. Well, this person who goes out to mow their yard and increase the demand on their heart is going to feel the angina. They won't feel it at rest. They're not going to suddenly keel over when they're watching TV and say, oh, my chest hurts. It's going to happen with effort. Unstable. So let me just go back. So that chronic is almost what we could call predictable. We know it's going to happen if they exert themselves. So unstable is unpredictable. And it's sometimes referred to as pre-infarction or crescendo. It gets bigger and more profound, muy profundo, as it gets worse. And so that's the angina that happens when someone's just going about their business. They're not putting an excess demand on the heart, but all of a sudden they have this angina. It's heart pain. There's lack of oxygen to the heart. And then there's a type of angina called vasospastic, also known as Prinzmetal or variant angina. So here's our patient mowing the lawn on a hot Saturday afternoon. He begins to notice chest pain. Well, what should be his first action? And you have choices here. Is he going to take his nitroglycerin tablet? Or will he stop mowing and sit or lie down? Will he first go inside the house to cool off and get a drink of water, see if the pain goes away? Or should he call 911? Well, this gentleman, what you have to know, has a prescription for nitroglycerin, and he has stable angina or effort-induced angina. So what we want him to do is take his nitroglycerin, and we're going to learn about nitroglycerin. That's this one. Stop mowing and sit or lie down. So at the first sign of chest pain, he needs to sit or lie down, stop the activity, and do that before taking the nitroglycerin. Reason is nitroglycerin, as you're about to learn, is a massive potent vasodilator. And if he's standing, and it works pretty quickly, if he's standing and he puts the nitroglycerin tablet under his tongue, he may actually have a drop in blood pressure, have orthostatic hypotension. to where he'll faint. So we want them to stop the activity, stop the demand on the heart, but also sit down or lie down, whatever's more comfortable, before they take the nitroglycerin tablet. So the drugs we have for treating angina are nitrates or nitrites, beta blockers, and calcium channel blockers. Therapeutic objectives for pharmacologic management of angina are to minimize the frequency of attacks and decrease the duration and intensity of pain, improve the patient's functional capacity, and prevent or delay the worst possible outcome, which is an MI. So a patient with extremely high blood pressure is in the emergency department. The physician will order therapy with nitroglycerin to manage the patient's blood pressure. Which form of nitroglycerin is most appropriate? Because it comes in all these forms. Are we going to do a sublingual spray? Are we going to do a transdermal patch, an oral capsule, or an IV infusion? So you imagine yourself, your blood pressure is so high that you're about to stroke. Which one would you want? Which form of nitroglycerin would you want at that moment to bring your blood pressure down as fast as possible so that you don't stroke? If you said IV infusion, you were right. So the answer is D. The IV infusion of nitroglycerin will have the fastest effect, and the dose is going to be titrated to the patient's response. So we're going to start the nitroglycerin infusion. The nurse is going to, RN is going to stand right next to the bed with monitoring systems on the patient and hand on the IV rollerball clamp to titrate, to speed up or lower, speed up or slow down the IV infusion of the nitroglycerin based on the response from the patient. So here are all those available forms of nitrates and nitrites. The ones with the asterisk, do bypass the liver and the first pass effect. Honestly, if I'm having chest pain, which means there's not enough oxygen to my cardiac muscle, to my heart, I'm going to want something that doesn't have to go through first pass effect. So I'm either going to want a sublingual tablet, an IV, a transdermal patch, or a translingual spray. Transdermal patch, while it bypasses the first pass effect, does not have an immediate onset. It has to be absorbed and reach a certain plasma level. So really, my two best options there are going to be sublingual and IV. So nitroglycerin is both rapid and long-acting. So that's a good one when your heart needs some oxygen. The isosorbite dinitrate is rapid and long-acting. And then the isosorbite mononitrate is primarily long-acting. So our mononitrate is not going to come into play when we have acute chest pain because it's not rapid enough. Well, how do these drugs work? Well, they cause vasodilation because they relax the smooth muscles. It's a very potent dilating effect on the coronary arteries specifically. So those big arteries coming into the heart, the pulmonary artery, you have the vena cava, all of that stuff, it's going to just dilate them and push all that blood in there. And the result is they get oxygen to the ischemic myocardial tissue. And it's used both for prevention and treatment of angina. So the indications are we're going to treat stable, and we're going to treat unstable, and we're going to treat vasospastic angina. Rapid acting forms, those first ones I showed you, the nitroglycerin and the dinitrate, the isosorbite dinitrate, are going to be used to treat acute attacks. So the gentleman mowing the yard, that's an acute attack. Even though he has stable angina, he's having an attack. The person in the emergency room with extreme chest pain, that's an acute attack. And we'll do sublingual or IV. We're not messing around with an oral or transdermal. We need a rapid form. Now, for somebody that has Prinzmental angina, for instance, and even unstable, we know that they are going to have anginal episodes. So we use the long-acting form to help with that. That's where your isosorbite mononitrate might come in, Or even remember that the nitroglycerin does work long acting, but you don't need it to be. If you look at the half life of the sublingual and the IV and of that, it's very quick. So you want to have something with a little bit longer half life, or and so you want that transdermal patch that's going to last all day to help prevent any anginal episodes. So we're getting a history on a patient who presents with chest pain. What drug class would necessitate the nurse informing the provider before giving the nitroglycerin? So the patient came in with chest pain. MD says, give the nitroglycerin, and you're getting a medication history first, and the patient takes a proton pump inhibitor, a phosphodiesterase inhibitor, an inhaled beta blocker, and an acetylsalicylic acid, which is aspirin. So which one of these drugs is going to have you calling the provider first before you give it? And your answer is the phosphodiesterase inhibitor or the erectile dysfunction meds like Viagra, Cialis, such as those, because these are potent vasodilators, and nitrates are contraindicated when they're taking this class of medications. All other classes can be safely used with nitrates. So isn't that nice? The only thing you have to remember, well, actually all the other classes that were listed were safe, but primarily with nitrates, you really want to remember that if they're on sildenafil or I can't remember all the other names will pop up here, but anything that's one of those you use with extreme caution. There's a few things here for contraindications, and obviously hypotension would be one. We're not going to cause more hypotension in somebody. Severe head injury is another, because we don't want the changes in the central nervous system that will happen when we give a massive vasodilator. And again, there they are, the sildenafil, the tadalafil, and the vardenafil, the Viagra, Cialis, and Levitra are contraindications. Adverse effect, it's going to be a headache. If for someone who's using the nitrates to control the events and the like with the Prinzmental angina, they will eventually adjust and their headaches will lessen. But for somebody who takes it only when they have an attack, they are going to get a massive headache every time they take it because they're not getting the adjustments and the tolerance to it. So that is something you need to understand. You'll have acetaminophen, you'll have the nitrate in one hand and the nitroglycerin and the acetaminophen in the other hand that you have to give them because it is a bad, bad headache. They can get reflex tachycardia, postural hypotension, so they need to be sitting or lying down. For the topical application, the transdermal, some skin irritation can happen, and it's pretty frequent under the where the patch is, and it gets better with time. They have to move the patch each time they apply it, so they're not putting it on the same spot. But it's not an allergy. It's not an allergy to the patch. It's just some skin irritation. So we advise the patient just to always move the patch and don't put it on in the same location. Tolerance to nitroglycerin can develop. So we're going to talk about that. So the ones where they're taking the long acting all the time, they can develop tolerance, which is why, again, the headache lessens and they don't have that problem anymore. But the issue is now they have developed tolerance and now they're going to have angina. So what we do to prevent this tolerance is there has to be regular nitrate-free periods that allow the enzyme pathways to replenish. So how we do this, so usually it's the transdermal form that they'll have the patch, and if it appears they're developing tolerance, we will have the patient put the patch on, usually in the morning, and take it off at bedtime and leave it off for at least 8 hours, and then apply a new patch in the morning. And that provides that nitrate-free period where the enzyme pathways can replenish, and that helps to prevent or reduce the problem with tolerance. A patient here has a known history of angina, and he's walking his dog and he develops chest pain. He immediately stops walking and sits down. So he stopped the activity. He continues to experience chest pain while he's sitting down. At what point should he call 911? And now this is someone with a known history of stable angina. When do you call 911? Does he call immediately? Does he call if the pain becomes more severe? If one tablet doesn't relieve the pain after 5 minutes? Or if the pain is not relieved after 3 tablets, taken 5 minutes apart? So I want to tell you that when you tell people, teach them about their nitroglycerin that they'll use as needed for pain, they can take up to 3 max. That's the max at any one time, but they do have to be 5 minutes apart. So that is the max is 3 tablets, 5 minutes apart. So we're talking about 15 minutes there. So the answer is C. That was if one sublingual tablet does not relieve the pain after 5 minutes, they need to call 911. Let's break that down. At the first sign of chest pain, don't wait until it's severe because it means there is a lack of oxygen to the heart. And if they wait till it's severe, they can actually die of a myocardial infarction. So take the sublingual nitroglycerin immediately. It should sting under their tongue a little bit. That means it's active and it'll work very fast. And they lie down or sit down and wait about 5 minutes. If within 5 minutes that chest pain has not subsided, they need to call 911. They can take the second tablet, but they absolutely have to call 911 or a family member can call 911 because it is an indication that this pain is not responding to nitroglycerin. And that person needs to get medical intervention immediately. So they take that second tablet, they're waiting for EMS to arrive. And if they continue to have chest pain, they can still take that third tablet after another 5 minutes while they're waiting for EMS. That's the max. They can't take any more after 3, but they can take up to 3. We do not tell them to take 3 tablets and then call 911 anymore. That used to be the old way. We said, take 3. If it doesn't resolve, now call 911. But we want intervention immediately. Like I said, it reflects the fact that the pain is not responding to nitroglycerin, which indicates probably there's an MI and they need cardiac intervention. I want to tell you a little bit about isosorbide dinitrate, or you might hear it called Isordil, because you'll see this, it's used really very often, but there's a certain population of patients who will be using this for their angina. It's available also in the rapid sublingual tablets, in immediate release tablets, and the long-acting oral forms. It produces a more consistent, steady therapeutic response. Oh, where's my, okay, I guess we'll talk about that in just a minute, the population that takes this, we'll come to that in just a moment. So we have the isosorbide dinitrate, and then nitroglycerin is our prototypical nitrate. It's the most important drug used in symptomatic treatment of ischemic heart conditions such as angina. All kinds of routes. There's PO, sublingual, metered dose aerosol sprayed under the tongue, IV, and topical. First thing to know about nitroglycerin. Remember that slide that had the asterisks that showed you the ones that avoid the first pass effect? And those are the ones I want because it has a very large first pass effect with oral forms. So back on this slide, you see it comes PO, right? We rarely see it PO. It's more often going to be sublingual under the tongue, this spray that you can put under the tongue, IV or topical, because when you take it orally, it has this huge first pass effect and you just don't get the benefit of the drug. Let's see. Here's the nursing implications. When somebody's prescribed this drug, we need to tell them, don't start, you've got to look at all the meds they're taking and keep a record of that. And of course, check for interactions and patient teaching that's appropriate. From that point on, we do not want the patient to take any other medications, especially over the counter, without calling and checking with their physician that prescribed the nitroglycerin, because the interactions can be profound. So we want to talk about that with them at the time this is prescribed. We talk about limiting caffeine, not because of a problem with nitroglycerin or isosorbate dinitrate, but because of the effect of caffeine on heart rate, and it can increase heart rate. Well, when you increase heart rate, you increase oxygen demand to the heart. So that's the part there about limiting caffeine intake, and that has to do with management of angina. We want these patients to avoid anything like blurred vision, which might indicate a problem with blood flow to the retina, to the optic area, a persistent headache, dry mouth, edema, fainting episodes, any of these things. The weight gain could indicate heart failure, definitely a pulse rate less than 60, or any shortness of breath. So the things that result in vasodilation, so someone who's already on a nitrate all the time, not the ones who take it periodically, but the ones who are on like the transdermal patch, if they already are inducing vasodilation with their drug, with the nitroglycerin. But then if they drink alcohol, get into a hot bath or whirlpool or a hot tub, or a sauna, this can result in profound hypotension and the possibility of fainting, or what they call a syncopal episode, where they can actually become injured. We want to teach patients to change their position slowly, avoid postural blood pressure changes. And for the ones who are taking it whenever they have an attack, we want them to keep a calendar. On the calendar, mark it or keep a journal of when it happens, what they were doing when it happened, which is called precipitating factors, how many pills they had to take, and then what was the result? Did it help? Did it alleviate the problem? Did they have to take one, two, three? So what were the therapeutic effects that occurred? So we're going to look at 4 parts here. I think it's 4, it might be 5, but I think it's 4. Nitroglycerin, part 1. Teach your patient the proper technique for taking the sublingual nitroglycerin. Sit down or lie down first. Stop the activity and sit or lie down. Then take it, put it under the tongue. Don't swallow it, don't chew it, don't stick it in your cheek. It goes under the tongue. Never chew or swallow it. They may feel a burning sensation under their tongue. That's a good sign. It means that your drug is still potent. And these patients need to keep a fresh supply of this medication on hand. I don't know if you've ever seen them, but they're itty bitty tiny little pills. They're not very big. And they're in a little small vial because they don't dispense a whole lot of them at a time because their potency is lost. And after about 90 days, once you open that bottle, their potency starts to degrade because of the exposure to light and oxygen. So we only give a few at a time, and they can have multiple refills if they end up using them. But they'll be in a little, usually a brown glass vial to protect them from light. Part 2, to preserve this potency, they should be stored in an airtight, dark glass bottle with a metal cap, no cotton filler. So we don't like that cotton that comes in all the medicine bottles, that needs to get thrown away, because putting it inside and taking it out and putting it in actually introduces microbes and pathogens into the vial. So just a small little dark glass bottle with a metal cap. We want to tell them how to properly put on the topical ointments and the transdermal forms. Now, luckily now with the transdermal, the patch, that has nitroglycerin on it, we're not having to measure out the ointment as much as we used to, but somebody still might be on it. But we would have a little card, like an index card, and it would have lines drawn on it. And one line might be 1 inch long, another line is 2 inches long, and a third line might be 3 inches long. And each one of those lengths equals a dose. So the 1 inch line might actually be, whatever that dose is they've ordered. Well, another patient gets more nitroglycerin. So you take your tube, think tube of like toothpaste, nitroglycerin, and you squeeze it out on the card, it's a plastic card, along that line to measure how much you're giving. And you make 1 inch long, you squeeze out 1 inch of drug, or 2 inches of drug, or 3 inches of drug, depending on how much the patient's supposed to get. And then you take that card, or you take a tongue depressor and scrape it off, and then you put it on their skin and rub it in. But you're wearing gloves, because if you touch that nitroglycerin ointment or gel and it's absorbed rapidly into your hands, you're going to have a potent vasodilation effect. You're going to get a headache, hypotension, you might have a syncopal episode, etc. So the nurse needs to wear gloves when handling the ointment or the transdermal patches. Part 3, tell their patient to take it as needed at the first hint of anginal pain. Don't wait for it to get bad. When you're giving IV administration, you're going to monitor the vital signs. They're going to be on hemodynamic monitoring. And then the person having chest pain, I can't say this enough. They need to lie down to prevent dizziness or fainting when they take their nitroglycerin. Part 4, when their anginal pain occurs, we're going to go over this one more time because it's so important. And there's a lot of the old teaching going on out there. We need to make sure to get the new teaching out. Stop the activity, sit or lie down, take a tablet. If no relief in 5 minutes, call 911 and take a second tablet. If there's no relief in 5 minutes, take the third tablet while you're waiting for 911. Do not drive to the hospital. You have to tell people this. Do not drive to the hospital. If you're giving IV nitroglycerin, the pharmacy is likely going to send with the infusion, the drug, they're going to send you special tubing and bags that do not have polyvinyl chloride, PVC in them. A lot of IV tubing and bags have PVC. Although I would have to say over time, I think they've been phased out because what would happen is there's so many drugs that will actually pull that PVC into the solution. It kind of leaches into the solution and it's not safe. So I think most tubing now and bags are PVC free, but if not, your pharmacy will send that with the drug. If your IV form is a color of blue, green, or dark red, like a strange color, you need to throw it away, get a new one. And then each manufacturer will have their specific instructions for IV administration or your facility's instructions. You'll be in the emergency room or the ICU when you're doing this. So for nursing, monitor for adverse effects. Those things are listed here. Teach patients for headache, they take acetaminophen, lightheadedness, hypotension, change your position slowly, and monitor then for relief of angina, decrease in blood pressure, or both. So let's look at a case study. The nurse is preparing to educate a group of patients on the management of angina. So which drug groups are most often used to treat patients with angina? The nitrates and nitrites, the beta blockers, and the calcium channel blockers are the drugs most often used to treat patients with angina pectoris. A patient asks how to apply transdermal nitroglycerin. What's the best response from the nurse? Let you read these. So you've got options here. The first one is putting the patch over your heart. The transdermal patch has a system where the drug is absorbed and taken into the systemic circulation. It's not a topical local, it's not a local effect, it's a systemic effect. So it doesn't matter where we put the patch, they will have a systemic effect. It does not have to go over the heart. Keep the previous patch on for 1 full day. So no, if it's time to put your new patch on, the old patch needs to come off so that they don't have too much drug. Apply it to a hairless area of the body. That is true because if it's not adhering well to the body, they're not going to get the absorption of the drug that's necessary. And then the last one is apply Vaseline to the body and then apply the patch. Well, you can well imagine if you put on Vaseline first, the patch isn't going to stick. So the correct answer was C, the third option there, where it needs to be on a hairless, residual-free area of the body and rotate them around. The old patch should be completely removed and a new one applied. And that's all for our nitrates and nitrites. I hope that you enjoyed it and happy studying.